Well, hello, everyone. It's me, Dave Eberly, again here from Lutheran Family and Children's Services of Missouri. And today we are continuing our series of trying to find ways that we can promote mental health within congregations and church groups, not just throughout the state of Missouri, but really throughout anyone who might find this beneficial. And we're continuing this series by extending our scope. We have reached out to the great state of Indiana today to meet with Carole Terkula. Now, Carole is a deaconess who is serving as a ministry associate for the Lutheran Foundation of Fort Wayne, Indiana. Carole started a new position there, and I will let her share a little bit more details about that here in just a second. But Carole, thank you so much for being here today.
Well, thank you so much, David, for inviting me to be a part of this conversation. I'm so excited to share with you some mental health resources and information with you all today.
Me too. Getting started into it, Carole, why don't you give everybody who's watching this video a quick background about yourself and how you came to work in this position you're at with the Lutheran Foundation?
Yes, well, as you mentioned, I'm a deaconess serving as ministry associate at the Lutheran Foundation here in Fort Wayne, Indiana. And I support the Reverend Dennis Goff, who's our Director of Ministry Programs here at the Lutheran Foundation. And in my role, I assist Reverend Goff in providing educational trainings, opportunities, and faith-based resources on the topic of mental wellness for the faith communities in the 10-county area, which we serve here in Northeast Indiana.
The Lutheran Foundation of Fort Wayne has had now several years of really investing in mental health resources in that local community.
Yes.
Can you talk about why the Lutheran Foundation has emphasized mental health awareness so much within that community now, and how it's led to your position there?
Yeah, so again, my position is relatively new. I was hired last February. Actually, I started about 10 days right before the pandemic hit. So it was kind of an interesting, introduction into mental health ministry. But yes, the Lutheran Foundation, for those, because you're coming from Missouri, and so many of your audience will not be familiar with who we are. I just want to let people know that the Lutheran Foundation is located in Fort Wayne, Indiana, and we are a grant funding organization which invests in Lutheran and community organizations to advance gospel sharing and to promote mental wellness that overcomes the stigma of mental illness. And the Lutheran Foundation was founded 25 years ago. We are actually what's called a healthcare conversion foundation. So our interest in mental health ministry really stems from our heritage, or our identity is a healthcare conversion foundation. So 25 years ago, the original Lutheran hospital here in Fort Wayne, Indiana was sold, and the Lutheran Foundation began with the sales of that hospital. And of course, the hospital was very interested in people's overall well-being, which included their mental health. And so it's just a natural part of our identity then as a healthcare conversion foundation to invest and help equip congregations to help people with their mental health.
Now, I also want to do a quick point of clarity. You mentioned, make sure you were from Fort Wayne, Indiana. We have a local Lutheran Foundation here in St. Louis, Missouri, and we work with them. They are wonderful people. They're also a grant writing agency. Fantastic group. But I want to make sure for those watching at home, this is a different group. This is a different organization, and they have their specific skill set, which is why we reached out to Carole, and she was kind enough to be here. So just point of fact, just to clarify.
Yes, thank you. Thank you for clarifying that. And just to answer your question a little bit further, in 2013, the Lutheran Foundation conducted a kind of a groundbreaking survey at that time called the Mental and Behavioral Health Needs Assessment. And that was given to people in 10 counties here in Northeast Indiana. And the results were rather startling in that many people in Northeast Indiana are struggling with mental health concerns, but the data revealed that they're not always getting the help or the assistance that they need, that there was a lack of funding for mental health care in this area, and also like a gap in funding. And so the Lutheran Foundation, based on the results of that data, determined that we were going to help stand in the gap and help provide funding for our local, Lutheran congregations, schools, and ministries here in Northeast Indiana to help people meet this need.
And as you've progressed, along with this advocacy, what are some of the most common issues you've encountered, things you've witnessed, especially dealing with congregations that you have worked and maybe had some successes in?
Right. Well, of course, across the country, and this pandemic has really underscored the need for mental health care. I think everybody during the past year understood that, this isolation wasn't good for our mental health when we were under quarantine, right? So the data is showing that there's been an increase in anxiety and depression levels in people across the country. Suicide rates have also increased. Calls to suicide prevention hotlines back in April last year, calls to suicide prevention hotlines increased 800%. There was actually an article in the Wall Street Journal today about the surge in mental health care cases in emergency rooms and in hospitals due to the COVID-19 pandemic.
We obviously know we're all facing this and we're all struggling in different ways. Mm-hmm. Specifically here, we're trying to focus on how we can promote these strengths within the church, promote mental health awareness. Why do you believe mental health awareness should be a priority within congregations, whether it be in Fort Wayne or here across the state of Missouri?
Right. Well, research shows that 1 in 5 U.S. adults struggles with a mental health condition. So if we really let that sink in, that means that in our average Lutheran congregation of maybe 100 people, 20 people are living with a mental health condition, and many of them are living in silence due in part to stigma around mental illness. So we want people to understand, that the person sitting next to them in the pew may be silently struggling with a mental health concern or have a family member that's dealing with a mental health issue. So it's not something really that's just out there, right? It's in our families and in our congregations. And secondly, Barna has done a survey which has indicated that 25% of people with a mental health condition will actually seek help from their pastor or from another church worker at church before going to their doctor or a counselor. So I think it really helps to underscore the importance that we really need to equip our pastors and church leaders and our congregations with mental wellness resources, especially on the tail end of this pandemic.
And that's a really good segue to my next question. And you and the Lutheran Foundation of Fort Wayne have worked to really build some good tools and some good ways that congregations, pastors, church leaders can be equipped to try to handle some of these mental health issues within their congregation. Can you talk a little bit about some of those projects that you've implemented during your time and how they came to be?
Well, sure. And actually, I need to back up a little bit and tell you a little bit about what has happened, before I was hired, because I told you we conducted that mental and behavioral health assessment survey in 2013. And then based on the data from that survey, we created the Look Up Indiana website, which contains mental health resources. And I'll be talking with you a little bit further about that, because when I came on board, one of the things they wanted to include on the Look Up Indiana website was some faith-based resources on mental wellness. And so it's been my pleasure this past year to help research and curate some of those resources on our Look Up Indiana website. But also I want to point out that the Reverend Dennis Goff was brought on 5 years ago here at the Lutheran Foundation, and he's been very integral in communicating with our congregations over the past 5 years about the importance of mental health and mental wellness ministries in congregations. And he actually began a couple of important conferences One was the Speak Up Conference in 2017, and we also had another large mental health conference in 2019 called the Look Up Conference. And we had over 800 people attend those, many of whom were church leaders and church workers and even lay people from congregations who were just very interested in the topic of mental health and how their congregations could be a little more proactive in helping their congregation members who are struggling with mental health concerns.
And when you go to one of those conferences, because I know you guys are planning one or are getting ready to have one, if I'm not mistaken, is that correct?
Well, we're planning to have another one, hopefully in May of 2022.
Okay.
So, yeah.
And then if someone were to attend one of these conferences, talk about some of the things that they might see or they might hear when they attend, something they might take from it.
Yes, so like I said, we had two big conferences. The Speak Up Conference was in 2017, and at that conference, one of the keynote speakers was Amy Simpson, and she gave a little bit about her personal testimony and her experience with mental illness and her family, and how she wished the church would have been more receptive to helping, reaching out to her family and showing, care and compassion and concern, during that time. So very powerful keynote messages. We had Kay Warren as our keynote speaker at our Speak Up conference in 2019, and she was able to share a little bit more about their mental health ministry initiatives there at Saddleback Church and some of the resources that they have available. There are other presenters, and then also breakout sessions where participants can go into smaller groups and have almost like a more of a workshop type experience with lots of questions and answers sessions at the end of those. So the whole point is to be able to provide congregations with education and information about mental illness, and what are some of the resources that congregations can pick up and start using within their congregations to help their members and their families who are struggling.
You're alluding to a couple of the other things too. You talked about Look Up Indiana. You talked about now here with this. Are there any other different tools or things you've created with the Lutheran Foundation that have helped try to promote mental health in the churches and the community as well?
Right. Well, we realize that there really aren't a lot of faith-based resources on the topic of mental wellness, especially from a Lutheran theological perspective. And so that's one of the reasons that I was brought on board at the Lutheran Foundation to help assist in searching for, vetting, and posting the resources on Look Up Indiana under the Faith Resource tab. So in that Faith Resource tab, we have something called the Mental Health Toolkit. And that is just chock full of some very helpful faith-based resources for congregations that they can pick up with and just start running with and feel like they don't have to reinvent the wheel, or they don't have to go searching for these things throughout the web, that we've curated them in one place for them.
So break that down a little bit further. You say it's a one-stop shop, essentially, that you can take to promote mental health within multiple ways within any church or congregation. Like what does it look like? What are some examples of things that are in there?
Right. So actually, we have two mental health toolkits. The first one we rolled out last May, for May is Mental Health Awareness Month, and we rolled out our second one this year for May is Mental Health Awareness Month. So there are two separate editions, but they both contain Bible studies related to mental health. This year's Mental Health Toolkit has a Bible study called Compassion in Action, Biblical Examples of Mental Health Care. We've heard back from several pastors that it's been a very useful Bible study with lots of good discussion in it. So we've been very pleased with some of the feedback we've received from that. We also have a sermon written by Reverend Dennis Goff on the topic of mental wellness that pastors can just pick up and use any Sunday throughout the year. There are also prayers. We have 10 prayers dedicated to mental wellness that congregations can use and feel free to edit and adapt as they see fit to use within the worship service, or maybe to use in staff devotions, or maybe for a variety of different ministry teams that may be meeting. You can have a devotion with a prayer specifically on the topic of mental health. We also have scripture references there. And we have a strategy document for congregations to help guide them through the process of how do you begin a mental health ministry and what that might look like. So that's a new addition in this year's toolkit, which has been very helpful. I've been using that with some of our mental health advocates to help guide them as they're beginning some mental health initiatives in their churches.
Now, I want to, you alluded to the mental health advocate program. I want to take some time to really break down that for the people watching, because I feel like that is something that can be so helpful and really work hand in hand with the toolkit, to really try to find a way to bridge mental health and the church, but also to not make it so that it's an extra responsibility on the church staff, that it's not something that's a hired position or something that, as we've heard, church staff are overworked, they are overburdened, they are hurt from this past year, and quite frankly, another responsibility would just be, nope, done, that's it, see ya, bye. So long-winded question, I should say. Talk more about the mental health awareness, or sorry, the mental health advocate program. Explain to people at home what that is and how you have implemented it so far.
Yes, and I think you brought up a really good point that, we've had these two big conferences in the past, and we've had lots of good feedback from those, and pastors and other church workers who attended were very supportive of mental health ministry in their churches and wanting to get it going. And some of them were able to do that. But for others, it did seem a little daunting or overwhelming to receive all that information and just feel like, oh, I just don't have the bandwidth or the energy to take, one more thing on my plate and try to deal with that. We know pastors and other church workers are stretched thin, every day, just trying to meet the needs of their congregation and in word and sacrament ministry. And of course, that's first and foremost for them. And we don't want to make it feel like a burden to do mental health ministry in the congregation. And so we decided to try a different approach this year. It's more of a grassroots approach where we're asking the pastors to nominate a lay person. It could be a staff person if it's a larger congregation that has, a parish nursing team or maybe a Stephen ministry team or a wellness team that's already in place. But most congregations don't have that. So we really are telling our pastors, if you can nominate a lay person who's passionate about mental wellness to really be a point person in your congregation.
What do the responsibilities of a basic mental health advocate look like in your structure? Because I know obviously everyone can take it and make it something different or something their own, but when you start and you help develop that program, what do you want a mental health advocate to do for their congregation?
Right. So this is brand new initiative from the Lutheran Foundation. We actually rolled it out in April with a mental health advocate webinar. So we have 92 congregations here in our 10-county area that the Lutheran Foundation serves. And to date, we have 25 local congregations who have nominated a mental health advocate. So we have approximately a quarter of our congregations, have signed up to participate in that. So we feel like we're off to a good start. So it really began with that orientation webinar to help explain further, even to the advocates, about the importance of mental wellness initiatives in their congregation, the importance of their role, and helping them to understand that they're not alone, that they have me as a facilitator, but also that they have each other, that they can lean on for encouragement and support and to share ideas and possibly even be working together down the road to bring some different programming and activities to their congregations and neighborhoods. We have an educational piece. I tried to provide information on upcoming events that some congregations are hosting that they can go and participate in for their continuing education on mental illness, and also supply them with some different resources that they can have at their fingertips. So we've even created a resource page for them where they can go and access the mental health toolkit, for example, and the assessment survey tool, which we have just rolled out. It's a congregational mental wellness assessment that we're asking each congregation to administer in their congregation so they can get a snapshot of the current mental health concerns and needs of their members right now. And that the data from that survey will help inform each individual congregation as to maybe what are the top 4 or 5 mental health concerns and needs of your congregation right now, that you can start to build a mental health ministry around. You can actually plan some educational trainings and provide resources on depression or anxiety or suicidal thoughts or PTSD or whatever it is that people are mentioning on the anonymous survey.
That is just fantastic. And I want to reiterate to those watching, this video, what Carole is talking about is a plethora of ideas and a plethora of strategies and implementations that they've worked so hard to develop. And these are ways that we can share that. Think about incorporating into your community. Think about these events, these programs, how they can fit into your congregation, into your small group, maybe your school, maybe your community group. Their ideas, and sharing ideas, sharing hope, sharing ways that we can all work together to not just deal with mental health as a whole, but to also build a community that cares for each other and loves each other and does so under the umbrella of Christ's love, in service, in glory, in all that we do. This is what we at LFCS want to try to promote and share. And it's the main reason why we have Carole here. And this is perfect. So well done, Carole.
Well said, David. Thank you so much. Yeah, we just want people to understand that as the body of Christ, we have the perfect opportunity to reach out to everyone in love with his care and compassion. And for people to understand that mental illness is just like any other physical illness, right? That there's a biological root to it. And so we want to help to reduce stigma through education.
So I have 2 final questions for you, because you're being very gracious with your time and I don't want to keep you any longer than you would require. I'm curious about your journey and how you've implemented these programs and your own personal journey. What have you seen as some of the biggest obstacles that are preventing Lutheran congregations from maybe embracing mental health ministries?
Mm-hmm. Well, I think still the number one roadblock is stigma surrounding mental illness. And we've been working hard at trying to chip away at that within our local congregations, but it takes time, right? It takes the opportunity to have these educational experiences brought into your congregation to help people to understand that mental illness is just like a physical illness. If someone has diabetes or cancer, they're often very quick to let the pastor know about it or request prayers for it from other congregation members, but often reluctant when it comes to being diagnosed with a mental illness such as clinical depression or bipolar disorder or schizophrenia or something of that nature. And we just want people to understand it's a biological, medical condition. So stigma, I think, was the number one roadblock. But something else that we already had mentioned is just the manpower to kind of get it up and running and off the ground. That, pastors are often overloaded with numerous other tasks that they need to take care of. And so part of this mental health advocate initiative is really to help have a point person in the congregation to help walk alongside the pastor and support him in rolling out some of these mental health initiatives so that he doesn't feel like the burden's all on his shoulders. Another thing too, we realized that many congregations didn't have access to especially faith-based resources on mental health. And so that's one reason why we created the Look Up Indiana faith-based resources, including the mental health toolkit, to kind of meet that need and fill that gap, so to speak. What we're finding too, or at least what's been challenging for me as a facilitator for mental health advocates, is that we have some congregations that have been doing mental health ministry for a number of years. And then we have other congregations that are just starting. So in my mental health advocate meetings, I'm trying to meet the needs of both And so that can be a little challenging too when you've got people with a variety of experience and you're trying to meet their specific needs. But I guess one blessing in that is that in our mental health advocate meetings, those who have been doing mental health ministry for a while are able to share, what's worked well for them, what's been successful for them, and help connect our newer congregations with mental health ministry to those resources, or just to provide that encouragement for them.
And you talk about the mental health advocate program and some of the ways that it combats some of these obstacles you've seen. Have there been any other challenges or unexpected issues that came up as you're first starting to implement this mental health advocate program that you maybe had to work through early on that you can share with everybody as helping with the growing pains, if you would?
Right. I guess the other big thing was just not to get caught up in the numbers. It could be easy to get disappointed and think, well, we have 92 member Lutheran congregations and only 25, have signed up. So I think it's just important for people to understand not to get discouraged in this, not to look at the numbers. Ministry is not about numbers necessarily. It's about the one person that's being helped and being assisted. So I think if people can just focus on the one person that may be reached and helped with what you're doing, as opposed to the big numbers, that can help and provide motivation and inspiration to plug on and keep at it. We're in it for the long haul. Mental health ministry initiatives are they take time. It isn't something that can just pop up and really take root overnight. So don't get discouraged and just keep plugging along at it.
Well, that sounds very similar to the process of healing from any mental health issue. It's never a quick fix. It always takes time, and good things do. So with that, I think I will end with a hearty thank you for not just the resources that you're sharing and that the ideas that you are sharing with all of us here, but your efforts, your work in the community, the innovativeness that you're doing, and your freeness to share it. The ability to just get this information out there and to let people use it. The mental health toolkit, free for anybody to use across the state. Look up Indiana's resources, share them, use them across the state. Obviously, you want to maybe reference Lutheran Foundation for their hard work if you can, but the goal is to help people. And there's nothing in my mind that is more of an example of being a witness to Christ's love, his care, and what we're called to do as disciples than sharing, helping, caring, being for others. So thank you. Thank you so much for everything that you were doing.
Well, thank you. It's my pleasure, and it's just great to create all these resources and have them available to anyone around the globe, right? Because it's all on the internet and they're free. And so I want people to use them. And if anybody has questions about the resources, or they would like some assistance in thinking about ways that they might be able to implement them in their congregations or organization, I'd be very happy to speak with them about that. So please feel free to share my contact information, David.
Absolutely. We'll tag your email on this link on our YouTube page. We'll also share the Look Up Indiana website. We shared the link to the mental health toolkit in last month's Mental Health Minute. We'll reshare it again because I really love that. I think that is a great asset for any congregation to have, as well as information about, we hear about the upcoming 2022 Look Up Indiana event that's coming through. If anybody here wants to do a little road trip, could be fun. But we will make sure that we connect people with links, resources as much as they can to brainstorm, to get ideas. Carole's been so gracious with her time and helpful. I can attest firsthand how wonderful her entire organization has been. So thank you again. So I appreciate your time, appreciate your effort. And for those of you at home, thank you for watching. We hope you can get something from this, and we hope this can be a help and benefit to you. So thank you all, and enjoy the rest of your afternoon. Bye.